Hello and welcome to another episode of Let's Talk About It. I want to welcome you all to a very special series called Medication Made Easy. My name is Emmanuel Jenkins. I am with the Delaware Developmental Disabilities Council. If you have not already, please make sure you subscribe to our channel so you never miss an episode. And make sure you like this video. Give us a thumbs up or leave us a comment. Today I have the pleasure of welcoming my very special guest. I got Jason and I got Alex, who is from accessiblepharmacy.com. That's right, you heard it right, accessiblepharmacy.com. And you may be wondering exactly what that is. Well, we're going to answer all of your questions about accessiblepharmacy.com. Welcome you both to this very special edition of Let's Talk About It.
Thank you, Emmanuel.
So before we get into what we want to talk about today, can you please share with our audience who you guys are, how did Accessible Pharmacy come about, and what roles do you guys play within accessiblepharmacy.com?
All right, well, I guess I can start that. Hi, everybody. My name is Alex Cohen, and I am a proud co-founder of Accessible Pharmacy Services. And first and foremost, we should let everybody know that Accessible Pharmacy Services is a comprehensive medication management healthcare company specializing in the needs of the disabled community. Now, I myself am blind. I was diagnosed over 25 years ago with a retinal disease called retinitis pigmentosa, and have been struggling with vision loss for most of my life. Despite that, I became a marketing professor. And a lot of the research that I do is about the inclusion of people with disabilities in the marketplace, both online and offline. And a lot of work that I had done was about the inclusion of people within the pharmacy space. And, identified that people with disabilities, medication management is difficult for anybody. If you throw in an extra variable, being blind or low vision or any other type of disability or impairment, it makes things just that much more difficult. And so I came together with one of our other partners who also had worked in the accessibility space. And we met up with our friend and partner, Dr. Jason Barrett, and created Accessible Pharmacy Services to fill a much needed gap in the marketplace. There are so many different options for where people can get their medications, but we really pride ourselves on understanding what it's like for our patients with disabilities. In so many other places out there, people with disabilities are an afterthought. Might have some type of an amenity or accommodation, just in case the blind guy from the neighborhood comes in. Well, that's our entire reason for being. That's our core competency, is to take care of people with disabilities and their specific disabilities. For example, of the different features and benefits, first and foremost, we view each of our patients as an individual with unique needs, right? People have, are progressing differently, have different support systems, different, levels of their disability, different types of medication they're on, and we work with each individual to find the best solutions for them.
Thank you, Alex. And I'm Jason Barrett. I'm a doctor of clinical pharmacy. I'm the chief medical officer at Accessible Pharmacy. I'd like to echo everything that Alex said, that what's so important to us is that each patient that comes our way understands that we have designed and implemented everything from our service perspective to meet their needs, both in a general sense in the blind and low vision community, but also in the specific sense that each person is an individual. And the one thing that I can say that we're most proud of at this point is that when we get to meet somebody as a client, we get the opportunity to become very well connected to them at a personal level and provide them a solution that meets their needs, no matter what their level of sight, no matter what their level of drug utilization is, or their disability in general. So as Alex said, medication management is difficult. Adding blindness, and now, of course, in the COVID pandemic, it's just becoming that much more challenging. So from our perspective, we understand that each individual is going to need something a little bit different. There is no off-the-shelf solution for anybody. And we've been so thrilled and happy to learn so much from the client base and to create a community that's completely accessible and inclusive. And, you know, as Alex said, one of our sayings is not in case of, but because of. It's because of the patient being who they are that we are here. And the one thing I can say for sure is that we will never stop learning. We will never stop innovating. We will never stop delivering a higher level of care. And to sort of marry to what we would call a highly accessible, highly inclusive environment, we're providing an extraordinary clinical experience as well, because we have married accessibility to better patient outcomes to provide the highest level of care for any patient. Our website, our materials are completely accessible, but our clinical professionals and our staff have been trained and are experienced in the specific needs of patients with disability. So when someone calls and they have a particular challenge, no one on the end of the line is going to say, wow, I've never heard of that, or I don't know what to do about that, because our people know exactly who the other person is on the end of that phone. Many of our employees are, in fact, in the low vision and blind community, both from a customer care perspective, but also from a sales perspective. So we have not only offered this to patients who are blind or have low vision, but we've brought people in that community in to help work with others. So there's an immediate recognition and understanding of what the challenges are on the other side. It's been an unbelievable experience for me. I've been so thrilled, and this has really been the most gratifying thing that I've ever done in my life.
Wow, wow. You know, you mentioned some very, very crucial things there. Um, and to know that you guys have not only provided such a great service, but you have people with disability as part of the model. And again, it's not it's not as Alex said, I afterthought. You guys came up with a service to provide, but you knew right off the bat that you needed people with disabilities to be part of that. It reminds me of that saying, nothing for us without us. To understand not only from a business perspective, but to understand the consumers who you are serving. So again, I'm excited, and again, thank you guys for sharing that. But can you go into just a little bit more detail about what you guys offer? I know you gave us a kind of an overlook of what you guys are, but can you share some of the specific services within that accessible product?
So Emmanuel, think of it as sort of what we would call two different pathways at one time. So the first pathway would be the entry into what we would call the accessible marketplace. So at the forefront of what we've done, before we even attempt to help anybody, is we've created an environment that's very, very accessible. So everything from the website to our app, to our employees, to the training methodology, to our workflow has been designed for patients in the low vision and blind community. So there is really no obstacles to access medication management. So you start off with, all the work that Alex has done and all of the research and time that he's put into accessible marketing and services, and combine it with the technologies that our partner Andy and Alex have worked on together to bring patients into our environment in a way that really relieves the burden. Burden is such a very big thing to all people, but let alone those that have a disability. We are pulling away the burden of access. We are relieving the consternation and anxiety about interacting with the marketplace. And at that point, when they come into us as patients, we're providing them with an extraordinarily high level of clinical pharmacy to help them manage their medications. So the way that we do that is, once we have their medication regimen, we put forth a number of different screening technologies and clinical pharmacy interface to explain to them exactly what each of the medications they're using is doing, and then provide consultation and connection to their physicians in case there are any inherent challenges to them adhering to their medications, or providing them with what we would call a decreased quality of life, side effects, unnecessary drug interactions, but also the affordability from the perspective of their insurance. Later on today, we're going to talk about Medicare Open Enrollment, but getting drugs right is not just about what they do for you. It's about what they do with each other. It's about how they change your day. It's about how you afford them. So bringing an accessible environment to patients, and then when they're here, providing them with a higher level of pharmaceutical care, greater connectivity to their physicians, greater connectivity to their insurance providers, a greater understanding of why they're taking their medications, any kind of precaution, and to be very frank, a second series or set of information systems so that they can have more confidence in what they're taking. On top of all that, we provide concierge distribution of medications in different kinds of packaging that are specifically designed to be used by patients with disability, that are much easier than traditional forms. And we have a number of options, because we understand one thing for sure: what works for me will not work for you, will not work for Alex or otherwise. And we mandate nothing. We provide a series of options. And the other thing is that the patient has the opportunity to change their packaging, their distribution schedule. It really is up to them in terms of what we offer to make up their own mind. But we have so many options that they can have the freedom to choose and to change if something changes in their world. If for some reason they are in a different living environment, if they now have a companion that they live with, if they don't have a companion that they live with, if their mail comes at the wrong time of day, we'll make adjustments to all of the way that they get their medications so that they feel comfortable and the burden is relieved. So I'll give you a simple example of some of the value-added services. We have what we call active refill management. So at any given moment when a patient's prescriptions are expiring, we're calling their physicians. We're making sure that they have backups on their refills. We're taking care of that for them. If there's a message that their doctor would like to send back to them, we are bringing that information to them. And if there's anything that they'd like to know about their medications, whether it be something they're on currently or something new, or if they have a question about something that they've seen on TV or something that they've read, we're there to provide them that support. At the end of every year, this time of year, as a matter of fact, we provide guidance for those patients who are in the open enrollment period for Medicare and Medicaid at no charge. So we access Medicare and we explain to them exactly the programs that they're eligible for and what their experiences are in terms of financials and what is covered and so on and so forth. So it really is, it's an accessibility platform that provides an incredible clinical pharmacy support system, as well as unlimited access to professionals who have been trained and have technologies that are specifically designed for them.
Wow, you guys do a lot. I almost want to ask you, what don't you do? Because it sounds like you do everything.
We don't do Windows.
You don't do Windows. That is very notable. You don't do Windows. You bring up something very, very important, and it's something that I experienced several months ago. And I can say it freely. I take lisinopril for high blood pressure, and I've always had migraine issues. But a couple months ago, I got a real bad migraine out of nowhere. and I before COVID, and I went to the hospital, and they did, blood work and the whole nine. And the doctor comes back and he says, your potassium is dangerously low, like low to the point where they had me hooked up to potassium through an IV. He gave me a prescription for potassium through a pill. And his question was, I see that you're on lisinopril. And I said, yeah, and I didn't think anything of it. He said, well, lisinopril can lower your potassium levels. Now, when my doctor prescribed it, he didn't mention to me, you know, he gave me the traditional side effects and things like that, but it was never mentioned to me, because you're on this, you may want to beef up your potassium intake. And once I was able to, which I'm a really big potato guy, love potatoes, so I had no, issue with trying to eat more potassium. But once I was able to do that, that started eliminating those migraines that I was having. So to know that you guys, not only look at the side effects, but look at things that may be interfering with it, some other medications or some of the other challenges that a person may be having. Again, thank you guys for really
So,
doing about.
so you've brought up a specific case study that is your own, and that's it's amazing that you had that experience, and I'm sorry for that. But the fact that you brought it up is interesting because we have in our system a number of screening measures that discuss, and this is something that I think we can talk about later on, what the nutritional concerns are for medication utilization. So that's a very particularly important part of our patient consultation, is to be wary of your dietary concerns, because so in your case, you're taking medication that may deplete your potassium levels. That's extraordinarily important for you to know, and also for your doctor to sort of be involved with, because they're going to take your blood and determine that, and then they can gauge the amount of potassium you take based on that level. But there are other medications that require a full stomach or an empty stomach or a fatty meal, and some that you want to avoid, nutrition with. There are some that, deplete, your B vitamins. There are some that, would make you need to take folic acid. So that's an extraordinarily important topic, but also our system has an artificial intelligence monitoring that observes all of those requirements and what we would call, precautions, and provides an external report for us to discuss with you. So if you're on a statin drug, for example, you'd want to think about using coenzyme Q10. That's a perfect example. If you're taking an antibiotic, you may want to think about using probiotics because it would deplete some of your normal flora. All of those concerns are cross-referenced in our system, and we're able to present that to patient both in a written form, but also in this kind of thing, in a discussion. So I'm sorry that happened to you, but it's a perfect example of how it's very important to be empowered and know your meds and have resources like us to help you with them.
Absolutely. So speaking of resources and speaking of you guys being in my eyes, a trailblazer to this kind of work. Uh, how, how long has accessible pharmacy been around?
So our base pharmacy has actually been around for nearly 50 years. But in terms of it being specialized in accessibility, it's really been the last year or so that we've done the research and crafted what we would call the platform. So, in many ways, Alex can tell you about his 20 years working in the field, and Andy his, and my 30, and so on and so forth. And I only have 30 because I'm older. Having said that, so really it's about 100 years of human beings working in different areas on sort of things that would help. And then the three of us coming together over the last, I'd say, year or so to start the process of creating a platform. But, it's just important to know that we weren't going to rush into this. We weren't going to bring it to public until we had everything that really would deliver the right solution.
Wow. I am in awe, and I'm usually not speechless by far. So to know that you guys have, and I keep saying it, but you guys are doing tremendous work. I mean, and that, you know, as we talk about medication and you know, some of the side effects and all of those things, you know, especially for people with disabilities, you know, even going to the doctor for a doctor's appointment is not an easy road. You know, I remember those times of going to the doctor, coming home with all these papers, and I had no idea what they meant or what, you know, what part did I need to read, what part can I throw away, what part was crucial to, you know, me taking medication. You know, was it specified that I must, you know, eat it with applesauce or eat it on a full stomach or, you know, things like that. So to know you guys really sound like a strong support system for people to be able to make those phone calls and to make those initial reach outs. And as we talk about supports, you mentioned something called open enrollment, which we really want to get into that conversation. But can you explain what the open enrollment is, um, you know, and what it is and when does that happen?
Sure. So the open enrollment period takes place every fall between October the 15th and December the 7th. And it's a period of time when patients who are in a Medicare environment have the ability to change their Medicare programs. For us, specifically the Medicare D program, which pertains to the drug utilization. Now, you know, patients have this opportunity. They have to be, you know, sort of, I guess what I would call flexible in looking at the drugs they're taking, the drugs that they take all the time versus the ones sometimes. And they have to understand the parameters of the program because it does change from year to year. What is also different from year to year is the companies that will administer medication, you know, coverage for patients. So some years there's a lot, some years there's less, and the parameters tend to change. So the open enrollment period starts on October 15th, which is tomorrow, and it will go until December 7th, basically the end of the first week. So it's really, you know, it's right around 7 weeks generally each year. Sometimes it extends if it happens to fall on the weekends. But, you know, it really is important for patients, especially those using medications, and a lot of them, to look at this. Now, there are patients who are covered by Medicare and Medicaid, what we call dual eligible, and those patients can actually change more frequently. So for patients who are dual eligible, they can change for the most part every month. So if there's something dramatic that's changed in their you know, medication utilization or their healthcare, they should always think about their coverage and keep an eye on what is you know, their availability in terms of programs. What we have done specifically is provide, you know, an information guide for them. So we take the opportunity to log on to Medicare. We feed Medicare all of the patient's prescriptions right from our database, and we provide them with a report that shows them all of the programs that they're eligible for. And from that point of view, we explain to them exactly what the parameters are. And I'll give you an example. So traditional Medicare D, there is the premium, and that's the money that you spend out of pocket each month. Then there may or may not be a deductible. And a deductible is what you spend up front at the beginning of each year to engage your coverage. From there, we have copays, and then we have other terms like the initial coverage. Then we have what we call the coverage gap or the donut hole. We've heard about that before. And then there's also the catastrophic portion of the coverage. So in each case, the patient's out-of-pocket expense is different. So it's really important for them to see that spelled out in an apples-to-apples mechanism for each of the programs that are available to them. The Center for Medicare and Medicaid Services has determined that only 2% of patients choose the program that's actually best for them. So whether it's because the premium or the deductible or the coverage, you know, it's very important for patients to get help with this, because I got to be honest with you, engaging Medicare and the Medicare website can be very, very daunting. It can take a long time. It can be a little bit confusing. It's not always the easiest system. And just to be totally honest, there's millions of people that are doing this all the time. So sometimes, just like at Christmas time, when you're trying to use a credit card machine, it can be a little bit slow because there's so many people. So what we basically do is use a series of different web services and subscription software systems to aggregate the data from our own computer system, send it off to Medicare, and provide a consolidated report for the patient. And then if they have any questions, we can provide them that guidance also. We don't choose their program. We don't guide them or lead them in any way, but we give them the information to help them make their own choice. And we do this every single year at no extra cost.
Wow, wow. So you mentioned you guys get a report and you lay out all the information for both plans or whatever plans are available, and then the consumer has to choose,
Mhm.
based on the information provided. Um, so when it comes down to an individual choosing that provider, I know you guys don't lead in any way, but what are some things that a person may want to consider?
Okay,
Um,
it's the best question you can possibly ask. So here's a perfect example. Your premium is the one thing that you have to pay every single month. So if you don't use many drugs or you use none, you still have to pay your premium. So that's a perfect example where you have to think about, how are my dollars best spent? If I don't use a lot of drugs, if I'm not a person that needs a whole lot, I may want to consider a very low premium, even if it has a high deductible, because I'm not likely to use it. However, if I use a lot of medications and I'm in a cash flow, I'm in a balanced cash flow budgetary situation, you may find that putting out the first $475 because of the deductible may be difficult for you in a particular month. So you have to be wary of that. Then what you need to look at is, what drugs am I taking? Is there a particular drug that is either not paid for by my program or requires a prior authorization or has a particularly high copay? So what you may want to do is look at a program that pays for that drug and maybe provides you with a little bit, different expenses in other areas. So really it becomes a balance of, how much do I want to pay every month? How much do I want to pay in terms of my deductible before I engage? What drugs are covered? What drugs are covered that I may not need, but I've been sick before? And I'll give you an example. People who have COPD, who have breathing problems, may or may not be using an inhaler all the time. Well, some of those drugs are very expensive. So if you use them often, you need to know that ahead of time, if it's covered and how much you're going to pay. If you don't use them that often and you say, well, geez, you know what? I've done really well. You may want to not worry about that as much as, say, something that would be for your heart or your cholesterol or your diabetes if you have those problems. So for people that are on a lot of medications, it really breaks down to, what is my total out-of-pocket expense? Because that's the other dollar value we talk. It's called true out of pocket. And for some people, that's the most important thing. How much am I going to spend through the year? And the other thing is, what is the access? Is it difficult to get? Is this particular program only taken by a couple of pharmacies? Or is this program limiting the number of medications I can get? Does it not have this feature or that feature? So it really becomes very, very individual. But in a grand sense, it's, how much do I pay a month? How much do I pay in deductible? Are my drugs covered? Is it difficult to get drugs covered that aren't with a prior authorization? And we can provide guidance for all of those issues. And to be very honest, we'll do it every single year because everything changes.
you know, I, I know we're talking about pharmacy and medication, but it's almost like people need you around when they're like buying a car or buying a house, or
It's kind of like that medication, yeah. Yeah, I mean, we don't do cars and houses, but it's definitely important for medication, for sure.
it is because you know, typically, again, I can speak from experience. Typically, I won't change, because it's easier to stay with the one that you already got.
Yeah.
But now that you mentioned it, that you guys do a report, and I don't have I don't have a thing where I have to use an inhaler all the time. But when the weather changes, wintertime is coming, I need my inhaler.
Yeah.
So when I look at the cost, it's like, man, maybe I should have switched providers. But I say that to say this: if I got someone there to run that report, present me with the options for that year, then I'm able to make something we call informed decision.
Educated decision. Absolutely. The
Um,
other thing, Manuel, is that if you have an inhaler on your profile that's particularly difficult, you may find there's another one that's preferred on your insurance program that will work just as well. And that's some of the other guidance that we also provide. Once you're on a program, say it's out of the open enrollment period, we can also help you make decisions, or at least give you information to talk to your doctor about when it comes to maybe an alternative. Because sometimes, I'll give you an example. So you're on an insurance program, a particular inhaler is preferred. Well, next year that may change, the formulary may change. So the question becomes, does it matter? It may not matter. You may find there's something else that you can use that would be less, and we can help with that also.
Wow, wow. I know you guys been around for a while, and you kind of zoned in on, making this thing fully accessible. So I know we shared a lot of information today, and we have some other videos coming as a part of this series, called Medication Made Easy. But how can someone get in contact with you guys? And before you answer that, can you also share how someone can become part of your service? How can they take advantage of your service? And, what's the qualifications? How easy it is to kind of switch over to you guys to get that support that you guys do so well?
Well, we try to make it as easy as possible for our patients, Emmanuel. So, we're certainly going to share how people can get in contact with us, and how they can become our clients and join our community. But the first step is contacting us, and then one of our customer care representatives will walk the individual through the process. And again, taking insurance information and some patient history. And once we have that information, then we can contact primary care physicians or cardiologists or endocrinologists or whoever else is part of this individual's medical team, healthcare team, and and their current pharmacy that they use, and have everything switched over for us. It's a very, very easy process. We estimate that in most instances, the call could last anywhere from maybe 10 to 15 minutes for us to fully onboard a patient and get everything ready for them.
Wow. Well, and before you share your contact information, I know like accessiblepharmacy.com is one of the most powerful ways to contact you guys, and I'll let you share that again. But you mentioned something earlier about how some pharmacies or some may not accept certain things. So I imagine you guys would accept whatever ones are available that year.
Well, we make sure that we accept any insurance program that we're able to. There are closed networks, we understand that. Some patients who are, say, retirees of a particular company or municipality may have an in-house system, but we don't shut the door on anything. So there will be times when, specifically something is more preferred, but, in the Medicare environment, we have a Statue of Liberty mentality. We take everyone who wants to come, and we're happy to help no matter what. So the other thing is that what is maybe a little different about us is that the level of accessibility and the level of service or otherwise that we provided is a value add. There's no extra cost for anything that we do outside of the medications and the health necessities that patients would like. So if it costs $1 or $2 more just because it's, we're out of network or otherwise, what patients will get for the time that we give them and for the services can't be measured in dollars, because everything that we do has been designed specifically for patients with disabilities in the blind and low vision community. And that's just not something that, we've seen as readily available.
That being said, the information, right? The consultations education, educational videos, the different level of packaging that we offer, very competitive prices for vitamins and supplements that can also be folded into the medication management system chosen by the patient, as well as fairly robust reminder systems. Again, these are all value adds. Our patients are not paying any more for these services. It's very important that they understand that.
Wow. Wow. Again, you told me you guys been around for a long time, and I just wish that I knew about you guys sooner. Because
Well, we're here now. We want everybody to know now. To be honest with you, like it's been a lot of research and a lot of work and a lot of integration of technologies and clinical professionals and accessibility professionals. So the one thing that we're certain about is that we are going to deliver quality, and that's not something that you can rush, and it's certainly not something that you're going to what's the right word to say this, wing. You know what I mean? So we put a lot into this, and we're certain that we're going to be able to help a lot of people.
So if somebody is watching this video and they are like sitting on the edge of their seat and they're like, I need to get in contact with Accessible Pharmacy because I love what they do. I love that they can give me a report about what options are available for the year. I love the fact that they have a prescription refill guidance before I run out of my refills. If this person is anxious about contacting you guys, how can they do it? How easy it is to get a hold of you guys to start that initial conversation, to eventually make the switch over to becoming a consumer for you guys?
We make it as easy as possible and offer several ways for them. They can reach us through social media on our Facebook and Instagram page, and arrange to have through those our social media to have a customer care representative contact them. And of course, there is our website at accessiblepharmacy.com.
And there's a phone number, 215-799-9900.
One other thing, Emmanuel. Anybody who has an iPhone could just ask Siri to call Accessible Pharmacy, and they will be connected.
Really?
Yes.
I almost want to try it live on this video, but I won't because Siri doesn't always listen to me. But I'm gonna give it a shot just so I know it works. But I'll do that offline. But again, thank you guys for sharing such a great information. I'm gonna make sure that all the information that was shared, as far as contact numbers, websites, I'll make sure all of that is in the description of the video for those that are watching on YouTube. This will be shared on Facebook and also our Instagram. I want to take a moment to thank you both again for joining me for one of many episodes to come within the special series of Medication Made Easy. This one wasn't, of course, in regards to open enrollment and really telling people who you guys are and what you guys do. But we have some other episodes that we are ready to go and look forward to bringing. I want to thank my people on YouTube for watching. Make sure you share this video. Subscribe to our channel so you never miss an episode. And also leave us a comment. Perhaps you have a question that we can relate to Accessible Pharmacy, and just perhaps we might get an answer back. So, again, you'll have all the contact information to do so. I hope that you will join me again for another episode right here live on YouTube. Thanks, everyone. Have a great day.
Thank you.
Thank you, Emmanuel.
Thank you.